Kenyan health experts are pushing back against growing misinformation around the HPV vaccine amid persistent fears that the jab could cause infertility or long-term health complications. At a town hall meeting in Nairobi today, doctors and subject experts sought to reassure parents that the vaccine now being administered as a single dose is safe, effective and critical in the fight against cervical cancer. And as Mary Moki reports, vaccine apathy has seen the vaccine register an uptake of less than 1% in northern Kenya and the coastal region.
Health professionals in Kenya are raising the alarm of a low uptake of the human papillomavirus HPV vaccine, blaming misinformation, religious opposition and deep-seated fears among parents at a roundtable meeting in Nairobi organized by the Kenya Pediatric Research Consortium. Doctors and other healthcare workers defended the country's shift from a 2-dose to a single-dose HPV vaccine schedule, saying the decision is backed by global scientific evidence.
We're actually urging all parents with girls of that age to visit their nearby health facilities so that the girls can be injected HPV vaccine. This will prevent them from contracting or rather getting cervical cancer.
There has been a lot of hesitancy when it comes to getting the vaccine and the issues around the side effects and all those. I want to put it clear from a professional point of view that this vaccine is actually 98% effective, okay? And I must insist that it's 98% effective when given between the ages of 10 to 14.
And we will continue to advocate for primary prevention, which is the vaccine, secondary prevention, which is screening, and tertiary prevention, which is treatment of all those diagnosed with cervical cancer as early as possible.
The HPV vaccine targets girls aged 10 to 14 and protects against cervical cancer, one of the leading causes of cancer deaths among Kenyan women, claiming 3,500 women annually. The World Health Organization recognizes that HPV vaccines are highly effective in preventing cervical cancer. Despite this, uptake remains low, with some parents fearing the vaccine could lead to infertility or future health problems. Claims health experts say are unfounded.
Prevalence of HPV uptake. Our poorest performers have actually been the northern region and parts of the coast region, where their uptake has been less than 1%. It has actually been very, very bad. In fact, in Mombasa County, at some point, the county immunization coordinator was very distressed that they were sending back almost 80% of the vaccines they're requisitioning for because they've made an estimate of the eligible girls in the county and this is not being taken up.
People who influence a lot.
Experts say the vaccine has been used worldwide for over a decade, with millions of doses administered safely, adding that the World Health Organization endorsed the single-dose switch after studies showed it offered the same protection.
We are telling the county to hire the...
Mary Moki, Citizen TV.